Welcome back to your Peterborough. We're here at Peterborough Public Health on King Street in downtown Peterborough on a rather beautiful fall day. Hopefully we have a few more of these in store. I'm delighted today to be joined by my guest, and of course it's Dr. Thomas Piggott, the Medical Officer of Health for Peterborough City and County, Hiawatha, and Curve Lake. And the reason we're here, hard to believe, it's been 1 year since you took on this post back on December 1st, 2021. But I want to take it even further back if we could. On February 11th of 2021, Dr. Rosanna Salvatierra announced she was retiring from her position as Peterborough's Medical Officer of Health. And it was a role she had for 13 years, and the search began for her successor. At the time, you were a world away, it seems a world away, serving as Medical Officer of Health with Labrador Grenville Health in the northern regions of Labrador. Take me back to when and how you heard about this opportunity, if you could, Dr. Piggott, and what motivated you to put your name forward for the position?
Sure, thanks, Paul, and thanks so much for having me on. It's exciting, and we were chatting as a team recently. It is exciting to have been here for a year now. So back, then the first I sort of heard about this was actually I was put in touch with Rosanna by a mutual contact who thought maybe this would be a good connection. Peterborough was looking for a successor, and so I vividly remember a telephone conversation with Dr. Salvatierra to talk about it. She talked at that time about how much she loved this community, how much she loved the organization. And it really planted a seed that I think started to grow. So by the time I had the interview and then the offer eventually in the summertime, I was pretty excited to be coming here and to be taking this job.
Was it a question of, and it might have been a combination of things, but looking for a new challenge, a fresh start? There were things about this job that you thought it could offer you professionally in terms of your development that you might not have been getting in Labrador, or maybe a combination of all those things?
Well, I think, to be honest, it was a little sooner than my family had anticipated to leave Labrador, but we had a pretty difficult 2 years there during the pandemic, being so far from family. And in Newfoundland and Labrador, the border measures, the lockdown, was much more significant, and people couldn't come in and visit. You couldn't leave without them quarantining when you came home. Mm-hmm. And there was a big period of time, an important period of time, because we had 1 and then 2 babies where we couldn't see our family. And I think for us, it really made us start thinking about being closer to family, which is something we deeply value. So this was in the back of the mind, and when this opportunity came up, I had heard about Peterborough Public Health before, having worked in Ontario before we moved out to Labrador, and I knew it was an organization that was deeply respected in the province, especially for leadership on things like health equity, fairness, the social determinants of health. Dr. Salvatierra and a lot of the staff here were just very engaged provincially. And in particular, this health unit was one of only a couple in the province that has relationships with the First Nations it serves, with Hiawatha and Curve Lake First Nations, that they are actually part of governance, which for me, having worked in a very Indigenous area in Labrador, was really important. And so I think I just started thinking more about the opportunity, and then we made the decision, we made the plunge as a family, and relocated here.
Checked all the boxes, obviously, right, for you.
It did.
So on December 1st, in this very same building, down the hall somewhere, I don't know, somewhere in here, you were introduced to the local media as the region's new medical officer of health. You rode your bike to work your very first day. That I do remember. A pretty healthy thing to do. Give me a sense of what you were feeling that day as you started to settle in, and you had applied for the job, you were accepted for the job, and you were finally here. You must have been pretty excited to get going.
It was exciting to be here. I had been in touch with some of the staff, so I knew just some of the wonderful people I was going to be able to get to work with. And we'd kept in contact from the point when I accepted the job to when I finished up in Labrador and started here. So there weren't all new faces, but I remember vividly getting to meet lots of new faces that day, doing the tour of the office, getting to meet wonderful staff, and And yeah, you have that kind of giddy excitement of a new opportunity, a new place. Now that quickly was eclipsed by Omicron, which, if you remember, came only several days later, and started to worry us significantly. So that changed things, and what might have been a more slow start meant that I had to really hit the ground running.
Yeah, no kidding. I want to talk more about the timing of your arrival with that, because you're right, it wasn't like an ordinary day at the office, right? But having said that, did you arrive with a set game or a set game plan in terms of priorities, both for yourself and for public health as a whole? And as you said, in late 2021, COVID may or may not have turned those plans all upside down.
Yeah, it did, and they did, but I think we made a lot of progress on my initial priorities, and I had a really good understanding of some of the key issues coming into the role, because our outgoing board chair, Mayor Andy Mitchell, and our Board of Health had really well equipped me and briefed me, as well as our senior leadership team here, on some of the key issues. So those issues are the ones that actually ended up materializing themselves largely into our strategic plan that we eventually had passed in August of this past year. But at the start, the board had given me some direction in a mandate letter around some key priorities. And some of them were, continuing the response to the COVID-19 pandemic, but also really taking care of our staff. We had a staff that had significant challenge with burnout. They'd been working nonstop for the nearly 2 years at that point of the pandemic. They were tired, and also there'd been some recent events, including people coming into our building, some charges laid in conjunction with that. Staff were quite scared of those experiences. So I knew I was going to have to really help to lead the team here in a way that supported and protected our staff, that valued them, that recognized just how much they have sacrificed through the pandemic to help our community. And I knew that the community, needed a lot as well. And it wasn't just on COVID. Obviously, that was front and center as we're still in the middle of a pandemic. But the other key issue was the drug poisoning crisis, which had really just worsened significantly through the pandemic period. And I knew that there was a lot of need to draw attention to that. So we started in on work on that very soon thereafter. And eventually, in collaboration with Forecast, who's operating the Safe Consumption site, and I think through significant advocacy of our local MPP, Dave Smith, the site proposal was approved, funded, and started operations in June.
You talk about how the staff was, well, for sake of a better word, there was a lot of stress, and that comes with overwork, but also the situations, as you said, with, some people, a small minority, voicing their opinion on mandates and that very strongly. You personally experienced that, and I know you well remember this on January 15th, that pushback against sanctions and restrictions got somewhat personal, and in what I have to think was a disturbing way for you, when protesters not only showed up at your home, but also showed up at your front door. How frightening was that for you, and by extension, your family? I mean, that's pretty disturbing, right?
It was a significant event, Paul, and I can't talk a lot of it because it's still a matter with the courts, right? Sure. So that being said, I think, it did impact us, but I think we were able to see the big picture and the context of everything. And in the aftermath of that, the overwhelming positive support from the team and our whole community, letters, kind letters, and kind messages on Facebook, on social media came in, and I think that overwhelming support really drowned out the negativity. But I will say, I think, as much or maybe even more than my family, it really impacted some of our staff because they became, fearful, could something like this happen to them as well?
Sure.
I personally have worked in other countries and contexts. I've worked in war zones. I've experienced far more significant and concerning safety threats before. I was able to put this in context and manage, as was my family. But I think that for others, it was a significant event, and it still is a significant event for us.
And I guess in its most basic form, it becomes a distraction. I mean, you guys have important work to do. and the staff here and yourself included in that, and this just becomes another thing that you have to deal with, right? You know.
It takes mental bandwidth for sure to be constantly thinking about that. And that has been on the back of mind as a friend of mine's been trying to take care of this community and respond to health needs.
You mentioned that community support, and I think we'd be remiss, because I thought it was pretty remarkable, and I know you do, that within a week of that incident, a Facebook group came together rather quickly in support of you and your efforts to keep us all safe. It quickly, and I mean quickly, hit 1,500 members, many of them writing messages of support. That had to be overwhelming for you, and you already alluded to that, but did that support tell you something about Peterborough that you didn't already know, maybe?
Well, I don't think I knew that there was that much, positive support, and it was really heartwarming, and I deeply appreciated it. My family appreciated it. I think all our staff did. I shared a lot of those messages, some of the cards and different things that people had written in. I was able to share them so that even though I guess they were initially mainly directed at me, because that was what was seen in the media, the whole staff could see and benefit by the positive messaging. And I think overwhelmingly, as much as there's been difficult periods in this pandemic, to me, the remarkable story is how we have come together in a way that's not only saved lives, but really I think brought our community together. And there are parts and people who have been drawn apart, and there has been significant challenge with some of that, largely with significant challenge with misinformation on social media, online these days. But overwhelmingly, I've just been so optimistic about this community and society, seeing how how well people came together.
I would never suggest that anybody in your position would need validation, but when you get support like that, it not only makes you feel good, but it says, you know what, we're on the right track here. We're doing the right things because people are noticing and it's making a difference, right? And who doesn't want to hear that, right?
Yeah, it was deeply appreciated. I'm not somebody who usually likes taking positive feedback. I'd rather focus on what can I do better, how can we do more. But no, it was kind. It was nice.
For the vast majority of us, pretty much all of us, living with COVID and staying safe starts and stops with our front door, with our family, right? With our immediate family, we want to keep them safe. You, on the other hand, along with your staff, you're guardians of the health of all of us. The burden of that responsibility has to be overwhelming at times. How do you cope with that? Or I know you'll probably say it's just part of the job, but I mean, again, you don't have just your family to look after. You come into work and you're making policies and approaches and strategies that affect us all and keep us safe.
I think it's just part of the job.
I knew you were going to say that.
But no, it's a team effort, Paul. I don't think it's just me, and it's not even just public health. Through the pandemic, we've worked with other partners, folks from our family physician and family health team, primary care community here in town, from the hospital, from our municipalities, the tremendous collaboration and support from our municipalities, other community organizations, the media. I think that I've never looked at it that I'm in on this work alone.
Sure.
It's been a tremendous team effort, and that I think gives me a little bit more confidence because I know that it's not just me, it's not just Peterborough Public Health, it's a full team effort.
If there's a silver lining to the pandemic, and I'm not suggesting that the
we should look for
pandemic
them.
itself is, but we should look for them. And is one of them that coming out of this or going through it, I know we're still in it, that those relationships with those partners have grown stronger, and that's going to just serve us in good stead? Because we can talk about this, but sure as you and I are sitting here, there's going to be other challenges, and they may be pandemic related. But are we in a better place now because of those partnerships?
We are, but we can do better. We certainly have gotten to a closer relationship with a lot of health and social and municipal partners. I think that the adversity, the challenge, having to rise to the cause brought people together. However, I think we can do more. And I think that we need to consolidate and really learn, both at a community level, but also at provincial and federal levels, about the lessons learned from this pandemic so we can do better for the next one or the next emergency. You know, there will be societal health-related challenges, the looming climate emergency, you know, the impacts are already here. Other potential viruses that may come forward. There are significant challenges with increasing income disparity, housing homelessness that are having consequences on health. So there's a lot of challenges, big complex problems we need to solve. So I think the pandemic brought us together, but I think we need to work hard now to learn from what we did learn about through the pandemic and to take it that next step so that we can ensure that next time we do better.
Absolutely. You know, any job, as you're well aware, has its frustrations, and I imagine your job is no different. Despite your constant communication to the public, you know, messages, directives intended to keep us all safe, total compliance has been and remains unattainable, and probably never would be attainable. But are there times when you want to speak louder and more forcefully? I mean, it's a fine line between urging people to do what they need to do to be safe, and then overstepping your authority so the full compliance can be achieved. I mean, do you sometimes feel like you're kind of like, I don't want to say a lone voice in the wilderness, but that it's not getting through, and is that frustrating for you?
Well, I don't think it's frustrating, but I think it's a really good point and something I reflect on a lot. And I think I always have to be mindful that mine is just one voice, and whatever I can do to help the most of our community trust it, I want to. But I know that speaking in unison with others is important as well. You know, for most of our pandemic press conferences, we had municipal leaders, mayor, warden, MP, MPP, politicians, leaders, other leaders in our community, hospital leadership, you know, chief of staff of the hospital, Dr. Mikula, others. I think that in those conferences that we had multiple voices speaking in unison, speaking together, no matter how people regard my voice, many voices are better and more effective. So that's been a focus of mine. I don't think it's been something that's frustrated me. It's just a reality. But it just means I have to work with others. We have to work with others, and teamwork can really advance some of these issues, I think.
Absolutely. Regarding COVID-related mandates themselves, you've taken and continue to take direction from Ontario's Medical Officer of Health, and by extension, upper levels of government in some cases. Has there been times when you, upon reflection, maybe you get home and you thought more needs to be done, but you're restricted because those directives kind of outline what you can do. What's in place, if anything, does that allow you to act unilaterally in doing what's best for the region? How much leeway do you have? And maybe you can just explain that. I know you have some limited, for sake of a better word, powers to impose some local sanctions, and maybe you could just run through what those are and how many, did you have to call on that a lot?
So, I mean, in my time in the pandemic, we only really did it once. It was right at the beginning of Omicron when we issued a letter of instruction for organizations, businesses in the community to escalate preventative measures. The province followed suit just several days, about a week later. That was through special legislation that was enacted during the emergency called the Reopening of Ontario Act, and it created special authorities for local medical officers of health to issue these letters of instruction. And those could be then subsequently enforced by law enforcement, by police. In the Health Protection and Promotion Act, which is the legislation that governs public health, there is the ability to stipulate orders. They're largely at an individual level. If somebody has an active disease, an infection like tuberculosis, and isn't being treated, it can compel people to seek treatment and ensure that they do have treatment. It can shut a restaurant if it's an imminent health risk to the public, those kinds of pieces. There have been some instances where there's been use of some of these authorities to broader requirements like masking, and other health units did that. We didn't. It ends up being a significant enforcement feasibility challenge because it's not law enforcement, it's the health unit and the few staff, the few inspectors that we have to to do that. So for the most part, in the recent weeks, months, in the context of things like masking, we've been trying to be as transparent with the data and speak as strongly with guidance and recommendations as we can, and then to continue conversations with the provincial government and advocate. If we were to do things in Peterborough, they would also stand out and stand alone, and would perhaps not be as effective as if we had unison and coordinated messaging. If we had something here in City of Kawartha Lakes didn't, this is just right near each other. People live and work between.
Yeah.
It just doesn't make sense.
And we saw a lot of that in the GTA, where people were crossing over to shop at stores that didn't have mandates, and a lot of confusion, right?
And that's not good. We don't want to create more confusion. What I do think is important, and what I'm really emphasizing now at this point of the pandemic, is there are big societal changes in positive ways we can do to continue to live with this pandemic and to prepare for others into the future. And it's not just things like masking. It's not just things like getting vaccinated at an individual level. Ventilation in buildings is something that's really been shown. If you have poor ventilation, transmission of infectious diseases can be worse. We need building codes. We need individual organizations to take leadership and say, we're going to develop better ventilation and ensure that the air is cleaner and safer. It has other health benefits as well, but then at least that way there's less of a risk of communicable diseases. We say stay home when sick. I think that's important, but easier said than done in practice if somebody works for an organization that doesn't provide paid sick leave. If it's between a paycheck to put food on the table and staying home sick to protect your work colleagues, people are going to end up choosing the decision that puts other colleagues and people at risk with symptoms.
Yeah.
And so these are societal changes that I think we need to be making, and they'll allow us to live a little bit more normally. I think masks are an important stopgap, and it's why we've been really advocating this fall that people start masking up again. We have not only COVID, but influenza, RSV resurging. And I think masks can kind of be thought of more like a winter tire sort of add-on when the risk is high out. And if we change and we make the roads safer completely, then maybe you don't need those winter tires. And the parallel here is if we improve ventilation and change structures, get paid sick leave, et cetera, maybe we wouldn't even need masks, or maybe the period we'd need them for would just be a few weeks at the worst time per year. But the reality is we haven't done all that work to change society, to improve ventilation, and to learn from the 3 years of the pandemic. And so with where we're at now, especially with the very concerning crisis facing hospitals and children's hospitals in the province, with lots of kids being sick, I think it's important for people to take individual precautions again.
And COVID is, the numbers are still there, as you're aware, or more than aware. Hospitalizations have increased. Do you think, all that being said, that we'll ever see a return to the COVID restrictions of 20 and 21, which were pretty stringent? The province of Ottawa has clearly signaled a desire for a return to normal kind of business model. And, I guess sometimes politics and public health intervene, right?
Well, it can be tough because, Paul, my advice and what I do is provide medical expertise and input. There are some programs that I deliver, there are some policies that I enact, but for the most part, what I do is provide advice to others, and we live in a democracy. Politicians are the one that put policies and laws into place. And when they make those decisions, I think medical expertise is an important one. I think it's maybe one of the most important ones, but it's not the only factor that goes in. They have to weigh values and preferences of people that elected them, that they serve. They have to weigh, economic, perhaps, considerations. So I'm always mindful that my perspective is one that is grounded in medical expertise, public health evidence. But it's a little bit more complicated than that when it comes to decisions. I think that we have, rushed to be done with the pandemic, and rightly so. It's been a long, nearly 3 years now. I think that we will see the pendulum come a little bit back more to center with perhaps a little bit more preventative measures and things in place. I hope those include things like improving ventilation, improving access to adequate paid sick leave, even trying to keep kids home and home when they're sick or home from school, maybe into the future a little bit longer on the Christmas holidays so we don't get as much transmission when kids come back. I think there are a bunch of different ways we could subtly adjust society that you wouldn't say, oh, this is like 2020, 2021. It would be a perfectly open and wonderful and, quote unquote, normal, new normal, but it would still save lives. And it weighs very heavily on me that we're still seeing a lot of transmission and we're still seeing death from COVID. This past week we reported 2 deaths from COVID-19 still. I mean, it's not over, it's not done. Vaccine's been a game changer and helped to protect most of us that have become vaccinated, but it's not the silver bullet. And we need multiple layers, multiple measures to really do the best that we can, saving lives.
Dr. Piggott, I thank you for this. I'd be remiss before I let you go today to ask you, if I didn't ask you, it's been a year. You came here, hopeful and optimistic that you could make a difference. This was the place you wanted to make that difference. Has it all lived up to your expectations? Has Peterborough been everything you hoped it would be? And from right here with your staff and your board out into the public as well?
Yes, I mean, I think it's more than lived up to my expectations. It's been a pretty interesting, maybe I'll say dramatic year. I hope that future ones are a little bit less dramatic. But that being said, I've been so grateful for the incredible team that I have here at Peterborough Public Health, incredible people that I work with and that work tirelessly to try to improve the health of our region, and have so much respect for them, my team here. The region is wonderful. The people I've met are beautiful, wonderful people. And this region is just absolutely beautiful. I've had a chance to do lots of hiking and canoeing and cross-country skiing and fun outdoor activities. And this region has lots of them. So my family's really happy to be here and look forward to many, many more years. So hopefully we can do this again.
And still ride your bike to work the odd time.
I do. I did today. I actually probably could count in a handful the times I haven't ridden my bike.
There you are.
Even in the thick snow. One time I cross-country skied because the snow was too deep for my bike. So
there you are. Well, you're leading by example. That's a pretty healthy thing to do for sure.
Oh, it's good fun.
Thank you so much, Dr. Piggott, for this. I know you're a busy guy, but I know our viewers will love hearing your views, and join me in congratulating you on 1 year and wishing you many more.